Teenagers are experiencing higher rates of depression than ever before, but as Dr. Malika Marshall reports, a simple smartphone app could help treat a common symptom.
2020 was an especially tough year for 16-year-old Avery Whitehead. With pandemic stress plus his parents separating, he was losing interest in activities he used to love, including sports.
I just kind of wanted to just sit and do nothing.
20% of teenagers have experienced clinical depression in the past year, twice as many girls as boys, and the problem has only gotten worse over the past 10 years. Christian Webb, a researcher at McLean Hospital and Harvard Medical School who studies teen depression, says a common symptom is rumination, having repetitive negative thoughts that focus on the past.
I'd always look back and just think negatively about myself or about actions or decisions I made.
Finding a child therapist is near impossible for many parents, so Webb and his team have partnered with Headspace to see if the mindfulness app can help teens with rumination. In an NIH-funded trial, volunteers, including Avery, performed different mindfulness exercises daily for a month, including breathing.
The reason to focus on your breathing is that the breath is in the present moment. It's in the here and now. It's not tomorrow. It's not yesterday. And so it's a useful anchor.
While the study is ongoing, Webb says there have been some initial findings.
Girls and older adolescents are more likely to benefit in the short term from using these apps. And in the longer term, teens that are struggling with rumination, that is repetitive negative thoughts about the past, are more likely to benefit from the app.
Avery says he's back to himself and back to playing sports and still uses some of the skills he learned from the study.
If I would start to ruminate, I'd be able to stop myself and then just have a better day overall.
And a better outlook on life. Dr. Malika Marshall, CBS News, Belmont, Massachusetts.
That study is still recruiting teenage volunteers between the ages of 13 and 19.